Welcome to the ICT&health Podcast with Lucien Engelen and Jessica Workum.
Welcome to the ICT&health Podcast. We are currently in Maastricht at the ICT&health World Conference 2026, where we talk with innovators across the world with regard to tech and healthcare. And today with me is Jan Liska. He is Global Population Health Strategy Lead for Sanofi. That is a mouthful, Jan. What is a Global Population Health Strategy Lead?
Well, it's someone who has a big problem to solve.
Tell me.
It's someone who is dedicated to shorten the 17 years gap that we currently have between something which is clinically perfectly operating and that takes 17 years to be actually implemented as a new standard of care. And when we think about urgencies that we have in terms of bringing care to people faster in a more relevant way and make them adhere, if it's the case of chronic condition, 17 years, it's not something that I can tolerate and that anyone should tolerate in healthcare.
Why does that take 17 years to bring innovation, proven innovation, to mainstream healthcare? What is up with that?
So don't expect a universal answer from me, because I think that if someone is able to completely embrace the magnitude of the problem and find the holistic solution, that would solve everything.
Yeah.
It will be a very humble, partial answer coming from my perspective.
Mm-hmm.
I started my journey in healthcare working in what has been called the patient centricity.
Mm-hmm.
And the whole point was creating a whole person-centered care that is not only about the treatment or the service or the medication, but it's really about how the person that needs this care adopts it and sticks to it in terms of adherence. And what I learned during those years is that you can create the most empowered person. You can create the most motivated family to actually solve something for them in terms of care if the system that surrounds them is not an enabling system.
Right.
Even the biggest motivation in the world will hit all the walls. And there are many walls there.
Mm-hmm.
Because health is actually created not only in clinics or hospitals.
Right.
Health is created in your family every day. If the people who share your life don't eat the same things because of your health, you need to eat something different, it's hard for you.
Right.
Health is created in your workplace. If the people with whom you work and as a same goal as them, you want to push your career and you have additional challenges to face and they are not aware about this, it will not be good for your health. If you live in an area where the air is not healthy, the soil is not healthy, and your home is not healthy, it's going to be hard. So, in fact, everything 24/7 interacts with your health. And
That is your challenge?
But my challenge is how we can actually meaningfully find the levers of health in
Right.
all these pathway, which is happening in the medical environment and outside the medical aspect, and create pathways to care that actually match people's lives so that faster and in a more relevant way, we bring the care to them. So that's my job, is how do we find those points of impact on people's health? Should there be inside or outside the healthcare system?
Right.
So that care can be seamless and perfectly matching people's lives.
Wow. Do you have an example of how, how you kind of transformed that from a...
So my job of global population health strategy has been created to serve a specific therapeutic area, which is currently one of the most fascinating, transformative healthcare endeavors that I've ever seen in my career. After hundreds of years of reactive management of type 1 diabetes, which is an autoimmune condition, we are, thanks to disease-modifying therapies, shifting to a proactive management and the prevention of T1D progression. What it means? It means that we need to redesign totally the care pathway.
Right.
In the example of type 1 diabetes, how this end-to-end pathway looks like. Currently, many healthcare professionals have been taught that type 1 diabetes is diagnosed as a symptomatic condition, and then basically treat it with insulin so that the supply of the insulin to the body can actually cover the healthcare needs.
So you mean that a patient has complaints, he gets tested, and then all of a sudden we get the diagnosis type 1 diabetes, and then we prescribe insulin and give him some management plan, and that's it.
You have the
very reactive, right?
Exactly. It is symptom. Basically, type 1 diabetes currently still too often is diagnosed through symptoms. Either symptoms which are observed by the person herself, or symptoms that are actually an outbreak, a crisis, diabetes ketoacidosis, the DKA, that basically brings you to EHR.
It's a horrible medical emergency, right?
Exactly.
Where if either undiagnosed or not seen, it could actually kill that patient.
And that's the stage 3 of the condition.
Right.
The condition has been there way before. The point is that...
You mean before the patient gets symptoms, right?
Before actually you can see it.
Yes.
There is stage 1 and stage 2, which are totally invisible. And there have not been many reasons for the families and for physicians to actually actively and systematically look for early detection of type 1 diabetes in the invisible stages, because there have not been solutions for it.
So there is amazing progress in type 1 diabetes, but there is still that 17 years gap that you talked about. How does that interplay?
Well, this is exactly the problem that me and my teams are trying to fight. We today start having in various markets new therapeutic options, which are disease-modifying therapies, that have been made available very recently. What it means that no one in the healthcare system has been taught about those therapeutic options as a standard of care. So the whole healthcare system is actually not yet aware about what is today all the therapeutic option and why actually active, proactive, early diagnosis of type 1 diabetes is something that is relevant, because now there is a solution. So what we are currently doing is actually working with the most advanced centers that are treating type 1 diabetes in actually co-designing with them this new pathway of care. What it means that the first half of the care pathway, which is systematic early detection, systematic screening, that has not been existing there, accepted as either a very proactive initiative of some healthcare professionals or sometimes a medical program. How do you actually shift it into what is the standard of care? We'll build this with them. So we help them identifying what is the best way to actually include it in the specific care protocols. We work with them how we can establish referral pathways with the general physicians who can identify families which are the most at risk of type 1 diabetes and send them basically to the endocrinologist for the screening. So all this has to be built. And to me, part of the 17 years gap is coming from the fact that there may be a lot of waiting, and there may not be enough clarity in terms of whose job it is actually to create those new pathways. And to me, this is a big question. And instead, us waiting for the answer to this question, we decided it will be our job. That we will establish this group of people whose full-time job is being those advisors and orchestrators of the teams internally in our company at Sanofi, but also externally in the clinics and the hospitals, to co-design those pathways together, to make this first half of the pathway for the early detection systematic, and for redesigning also the second half of the pathway to include new therapeutic options such as disease-modifying therapies alongside the insulin. So that's our job. It's really helping the systems adopting innovation faster.
And what are some of the challenges that you see when you are bringing all these people together and you're creating these new pathways? What are some of the challenges that you're seeing?
So in terms of type 1 diabetes, the first challenge, one of the challenges that I see actually very frequently is the interoperability of the systems in a hospital. I mean, when I spoke with my colleagues from Italy, they were telling me sometimes we are going to a hospital where you have up to 8 different digital systems coexisting without being interoperable. How can you create systematic and seamless pathway when you have systems which are not interoperable? Second challenge to me is how can we actually show a true economic value proposition of prevention and proactive healthcare versus the current economic models being very much built on actually reactive management of care. So it's how do we shift the economic thinking? How do we shift the interoperability thinking? And of course, I mean, the usual one is how do you also shift the mindset?
Yes.
But on this one, I will probably sound a bit more provocative than some of my colleagues. I think that many of the healthcare innovators are sometimes speaking about the brokenism of the systems. We need to fix it; it's broken, and so on. And when you try to fix something which is broken, you may be interacting with people who are on the negative side.
I agree.
And it's hard. And those people will tell you, oh, you see, it's going to be hard. And because you surround yourself with the people who tell you it's going to be hard, it becomes hard. And and that's my big take, is find the people who are already motivated to do something differently and make it easier for them.
Right.
And it's not my genius. I've been actually trained with BG Fogg in Stanford, and this is basically his model.
Yeah.
What BG is saying, and I think this is so valid for innovation, especially in healthcare, not only for the patients, but also for us who can make innovation happen, is if you want to do something differently, find the people who are already motivated to do something differently and make it easy for them. Because otherwise, all the time that you spend by trying to build up someone's motivation, and motivation is multifactorial, it's super hard.
Yeah.
So if you use all this time for working and make it easier for people who are already motivated with the right prompts, you go much faster. So this is probably my solution for actually trying to making these 70 years a bit shorter, is starting where people are already on fire and see what happens.
Beautiful. Thank you so much for your time.
My pleasure.